Well, the medical marijuana business is booming in New Mexico. The industry says the effects of COVID have dramatically increased demand and they are trying to keep up. News 13's Rebecca Atkins is looking into the spike.
Well, not only have sales skyrocketed, but the number of people getting medical marijuana cards has also gone way up. So because of this, one of the state's biggest medical marijuana distributors commissioned an analysis to figure out why this was happening.
And what we learned, it wasn't just a New Mexico thing. In fact, the number of transactions have doubled in New Mexico, prices have gone up, and the supply is pretty much in a very dire situation and very short.
Duke Rodriguez is the president and CEO of Ultra Health and says their analysis showed from the final quarter of 2019 to the first quarter of 2020, the number of retail transactions nearly doubled. The analysis also found that medical cannabis patients are at an elevated risk and want more medicine during the pandemic. They say contributing factors are increased loneliness, depression, anxiety, fear, and concern about the future. Grassroots RX, a dispensary along San Mateo, says they've seen a significant increase in purchases. And at Zia Health and Wellness, they say they've seen an uptick in medical card renewals, especially in people who hadn't renewed their cards in the last few years. And with the demand up, Rodriguez says they need to be able to grow more plants.
We're up 250%, almost 3 times what we were the same time last year. This is not just going to be a short-term problem. This is going to stay with us. So the goal has to be 2 things. It's important that the state increase the number of plants, allow more plants to be produced so we can bring down the cost, make more available medicine, and reduce the level of fear. And number 2 is we got to allow patients to buy what they need.
Rodriguez says according to the CDC and New Mexico state statute, medical marijuana growers are supposed to have a 3-month supply on hand. And right now, he says they only have 12 days. Back to you.
The Department of Health says they are always reviewing the data. They say they anticipate a 25% increase in plant availability through the licensing process occurring right now.